Hi, I'm Leslie Ester. I'm the Chief Nurse Representative at St. Joseph's Hospital, Eureka, and I am with California Nurses Association. And we're out here today. We're actually doing an informational picket about the change that St. Joseph's Eureka has instituted this morning to the way that cardiac patients are cared for. And so I've been told that many people don't know what telemetry is. And telemetry is the monitoring of cardiac patients, looking at how their heart is operating. So usually when we have, prior to this morning, a patient that needed telemetry or cardiac monitoring, they would go to our progressive care unit. And those units are built so that they have hardwired technology that can monitor the patients with video available right there so we can see what's happening to them in real time. That technology is also in monitors out at the nurses station and at the monitor techs. So everybody has a clear view of what those cardiac patients are doing in real time. And that unit is staffed by nurses with many, many years of experience with a cardiac patient population. And they also have specialized training for that population. So the change that the hospital implemented today was to take that unit and one of our medical surgical units and make them both available to accept telemetry or cardiac monitored patients. And why we want this change not to be implemented at this time is that the medical surgical unit doesn't have that built-in wired capability to monitor in real time except for at the monitor tech station, which is downstairs, sort of in the basement. So if you walk into a patient's room on medical surgical 2, you will not see the monitoring, you will not see in real time how they're doing. If you walk to the nurses station on med surgical 2, you will not see how that patient is doing, you will not know exactly what is happening with them. In addition, the nurses on med surgical 2 only got very brief several hours training on EKG reading. They don't have the specialized training that is needed for this patient population, not only in terms of monitoring and being able to make sure their care plan's going well, but also in administering medications. So what we're hoping for today is that the community realizes that we're going to have two standards of care. If you're in the emergency room and you need to be admitted, you could be admitted to a very, very well-trained and properly equipped unit, or you can be admitted to a very nice med-surgical unit that doesn't have the training or the technology that's needed for your care. So we've asked the hospital to not implement this for another 6 months when they're going to do a technology upgrade anyway. That would give them the opportunity to put the right technology in place, and also 6 months to train the nurses. With what these cardiac nurses usually get is about 4 to 16 weeks of specialized training. We're asking the same for these medical surgical nurses.
Anything to end on?
I just want to say that the nurses are out here not for any gain of their own, but to make sure that our patients are safe.
Thank you.
Thank you.
Appreciate your time.
Thank you.